Hello, how are you? I hope that you are doing well today and that your day is found in perfect peace no matter what's going on in your life. I wanted to take the time to say thank you um, for all of your engagement with this channel, from subscribing, watching the full video, commenting, asking questions. Whatever your engagement is, I do thank you very much, and I most definitely appreciate it. So, I want to say that I am not a medical doctor. My full disclaimer is in the description below, but I am a uterine health advocate. Okay, so today, uterine health. Let's talk about it, right? So today I just wanted to provide you with an update regarding my own uterine health journey that I have been sharing with you. I think since the beginning of this year, but definitely telling you what was going on for my uterine health of 2025, right? So if you've been following along with my uterine health journey, you might recall that I had my last scheduled biopsy, in-office biopsy, didn't go as planned. So the next step was to have a hysteroscopy, procedure for me to be able to get a biopsy, to be able to, get some cells from the uterus to see, what's going on since I started taking the progesterone and post last year after I was diagnosed with non-atypical hypoplasia. So, and so I highly recommend that you go back and watch that video so you'll understand, why I needed to have this procedure and why the in-office procedure didn't work. I highly recommend, of course, you go and follow the journey because I try to be very open and transparent about my uterine health journey. And I do believe I made a video, but I'll go back and check myself about what a hysteroscopy, and I hope I'm saying it correctly, is, and what happens when you have one. So those are very helpful and might might make sense of all of this. So just to bring you up to date, so again, in June, my in-office biopsy appointment did not go as planned. And that is because there was some kind of blockage in my cervix. So the tools that they normally use in office to biopsy couldn't go straight there. And I appreciate my doctor. She just did not want to go in there blindly, not seeing where she's poking and then injure or rupture something else. So that's why I had the hysteroscopy appointment. And all this is due to my fibroids, how my fibroids sit in my body. So, and just for reference, I did have a hysteroscopy last year. So this in August. So this will be my second hysteroscopy appointment. So prior to the procedure, when she came into the room, my doctor, I did ask her about three questions or something like that, thing that was on my brain that I wanted to know. And, just from one of the videos I did in June during Uterine Cancer Awareness Month, I wanted to know, was my uterus a pear shape? And she said, no, my uterus is large due to my fibroids. Then I wanted to know also, based on one of the videos I did in June, was my uterus tilted front or to the back? And she said, due to the size of my uterus, is because it's large, it's just sitting right there. So it's just sitting right there in the middle. So I says, okay. And then I asked her how going forward, because if you follow any of my videos, how are we going to measure how would my uterine lining being measured? Is it, because it went from a 11 to a 22, almost a double the size. I did explain to her that personally, I'm not interested in having another ultrasound. The year of poking and prodding was just overwhelming. I can't even imagine, what others go through. So she explained to me that, definitely looking down at my notes because this was a lot of good information. So I might apologize if I'm going like this and that, right? So she explained to me that the growth of the uterine lining is a signal that the cells are abnormal, right? That is the purpose of having the biopsy. If test results show no cancer, progesterone is working, and hopefully the uterine lining has not grown any bigger. Maybe it's maintained where it was, or even may have decreased in size. So I just want you to know that as well. So, and that made sense to me because I thought about it, how when I first started spotting of the blood, that was my signal, to say something to my doctor. And then when I had the ultrasound and they saw the uterine lining was larger than normal for a postmenopausal woman, then that was their signal to check the doctors, to check to see what's going on. That was their signal that the cells were abnormal. I did inquire how long I would need to take progesterone. I currently take the pill form, and she said maybe 2 years in total. But she wanted to wait to after she, did the biopsy to get the results back to see where I stood at that time before she made any final or definite recommendations. But she did explain to me that there is no data that says, how long you take progesterone and then everything is great, or how long you should stop taking it. So there's no data on the length of time you should take progesterone. It's just the data suggests that taking the progesterone does work because does work to help balance out the estrogen and the hormonal imbalance in the abnormal cells. So I was going to go and ask her another question, but I changed my mind because I wanted to know if you can have an enlarged uterine lining and not have cancer. I changed my mind just based on some of the previous notes that I saw and the previous biopsy results. So I says, I can skip that question. So one cool thing I did want to share with you. So that's where I was, and this was all before the procedure. So one cool thing I did want to share to you, I was rolled into the operating room and I still was awake. For this procedure, you are placed under a mild anesthesia. Anesthesia. So yes, and so I got to witness them doing what I'm calling an oral check. They mentioned my name, the procedure I was having, and each person in the room mentioned their name and their position. Like, I'm Judith, I'm the doctor performing this. And I thought that was pretty cool. And it seemed like as soon as the last person spoke, and I was completely out. So I thought this was good information if you ever wanted to know if anything ever happened, like who was in that room and how many people was in that room. Maybe you could have that information, but I thought that was cool. So this isn't, hysteroscopy is an outpatient procedure, like I talked about in one of the previous videos. So I was able to go home that same day, but because I was under anesthesia, I did have to have a ride home. But of course, they gave me parting gifts. So whenever I leave, I have I have the bag here. They can give me a little bag. So whenever I leave an appointment, they give me a after visit summary that kind of lets me know what I should and shouldn't be doing, what I should and shouldn't be doing, and then also some of the precautions I need to take, but they gave me, I hope this is not too much TMI, they gave me these to wear, which, in case I have any additional bleeding or things of that nature, I wore one of these home. So they gave me about 2 of these. I feel like I'm doing a unboxing, whatever they do with social media. And they gave me one of these, in case you don't know, Kotex pad. So I got one of those, and I got one of these. This is like one of those instant hot packs. So if I felt any pain in my lower abdomen area, I would be able to squeeze this and be able to put it on that. So, and they also, so I just thought I would share that with you. So they gave me a goodie bag when I left the hospital, right? And so she also gave me, because I don't know why I asked for a picture once of my uterus. And so she gave me a picture of the uterus. I don't know what I'm looking at. It's probably just like I say, a little camera going down a tunnel. So, but one of the things that she said was that my uterus looked good on the picture that she gave me before I left the hospital. So I took that as a good sign that there was no sign of cancer. I took that as a good sign. That's what I was just believing and hoping for. So while I was waiting for the test results, I do want to share with you that I did have 2 symptoms that they did speak about on the after the procedure summary. I did see spotting of blood, and I was a little, nervous, I'm going to admit, because that's what started this whole journey from the beginning. I did have a day of bad cramping, which is also to be expected. And thankfully, she prescribed a high dose of Tylenol to me. And I'm going to say this, if your doctor offers, I think I've said this in one of the previous videos, if your doctor offers you any kind of pain management, I say take it. Better to be safe than sorry. I picked up the pain management, Tylenol, whatever, it's called. And the next day is when I had those severe cramps. So I think it's very important for, like I said, to be safe than sorry, and yeah, to each his own. Maybe you might want to suffer through it. Not me. It was painful. So about a week later, I did receive a message from my doctor via the patient portal with my with my test results. So I felt like that was a good thing because I hope that if it was something serious, she would, take the time to call, and I think that she would because she's been very, very active and communicating throughout this whole uterine health journey. So she sent me a message saying that the test results were good and normal, which meant that there was no sign of cancer or precancerous cells. So normal mean that they went, the abnormality that was there before is now gone and there's nothing. And so all of my biopsies have always shown, thank God, um, all of my biopsy appointments have shown, no cancer or precancer cells. And the level of gratitude is, there's no words. So I'm very grateful. And then she said in the patient portal that she would reach out to me a week later. So if you've seen any of my previous videos, you know that I'm always an advocate in encouraging you to have questions prepared when you know that you're going to meet with your doctor, so that it's a time that you can have a great meeting with your doctor to get understanding and have any kind of questions that maybe that are still lingering and you don't understand. So having your questions is important. She just said that she would reach out to me the following week, so I didn't know when that would be. So I put all my questions and I had them ready on the phone, and I just want to be able to go over them with you so that you can, so grateful, so that you can, kind of see the questions I asked and her response. So I think it was like a good 4 or 5 questions. So I don't try to bombard. I do whenever I meet with my doctor, I let them talk, let me know what I need to know, because sometimes they answer the question before I even need to ask it. So one of the first questions that I did ask my doctor was, were you able to find the cause of the blockage in my cervix that prevented me from having an in-office biopsy? So let me just pause again in case you just say. So when we got on the call, she did go over and say about the results of my biopsy, that everything was normal and everything was good. So let me just say that. And then, she said some other things, and then we got into my questions and things of that nature. Um, she reiterated that it is because of the positioning of the fibroids and how they are in my body, mainly in my uterus area, around the uterus area. So that's what it is. So she said, and she even said, even during the procedure, she had a difficulty getting the tool past my cervix to my uterus to gather cells for testing. She said it's almost like if you're driving, it's not a straight path, which it normally should be, which would have been a successful in-office biopsy, where she just goes straight in and up to the uterine lining, grab some cells, and come out. And it's although it's painful, in-office biopsies are painful, it is very quick. So she said it was still like a winding, curvy road, and she said she did have some difficulties even with me being under anesthesia. Only difference is I wouldn't have been able to handle the pain. So that's one of the reasons for me even having the procedure. And, with the hysteroscopy, with the camera, she said she just still just had a difficult time, but she made it work because I was on a anesthesia, and she knew how important for both of us, for us to gather some cells so we can get some, good test results of that. And she did mention if I needed to have another biopsy in the future because of where the fibroids sit in my body, I would just have to do a hysteroscopy, because she, the camera kind of gave her at least a light for her to direct the tool for her to see. But if in the office she doesn't have that camera, right? She doesn't have that camera, and she doesn't want to be blindly trying to force, which I'm grateful. She doesn't want to force anything, and then she ruptures something else, and then I could have some other kind of severe pain because of that. But I didn't ask her, and maybe I'll ask her next time or do some research if we get to that point. is there something that I can have total numbness down in that area? I will make a mental note to ask that. So that was the first question. So it's the fibroids that was causing the blockage in the cervix. So now it's a winding road instead of straight shot. The second question I asked her was, prior to the procedure, you recommended me staying on the progesterone for 2 years. Since I'm on my last bottle and my last pill will be September 19th, will it automatically renew? What are the next steps in this? And because September 19th will be the end of the first year. So I am one of those people. I don't take medication. I'm very grateful. So this was my first time being on prescribed medication. So I wanted to make sure I did my due diligence. So I actually put the day I begin the bottle of medication and the day I end it, so I could just be on track. And I put that in my phone, in my calendar. Everything is there because that's just how my brain works. So she explained again that there is no data that states how many years you should or should not be on progesterone. Her recommendation was that I stay on progesterone for a total of 2 years. So September 19th would be ending my first year of that, just in case, just for recap. But based on my test results, this is my decision since my cells are now back to normal. So my decision was, I decided to stay on the progesterone additional year for precaution purposes. And she would put in a refill for additional year. I can at any point, if I feel like after 6 months I want to stop, I have that option as well. But I at least wanted to have that prescription there and ready just in case. And I don't want to, just for mentally, I think I just felt better, just taking it just to be sure. I remember the doctor that I saw in December. When my other doctor wasn't available, she said, "Oh, you're going to take this for the rest of your life." I thought, oh my goodness. But yeah, so, but that's not the case because I know who provides my healing. So the third question I did ask my doctor was, because at the end of the first hysteroscopy appointment, I was diagnosed as non-atypical hyperplasia. And that means that when they tested the cells, there was some abnormality there. And that was because the uterine lining, hyperplasia is the growth in the uterine lining, but non meaning that I don't have any cancer. So there was no precancer or cancer cells. And she said that that was a diagnosis at the time due to the enlargement of the uterine lining. But based on the recent test results from this biopsy, she believes that the uterine lining has either gone down, stabilized, or not had any kind of growth. And she believes maybe it has even regressed because I don't show any of the normal symptoms that that normally displayed. And then again, the test results show that my cells are normal. So that is no longer my diagnosis, as my cells are normal. I felt like, how people sometimes they have like diabetes and they take the initiative to do whatever they need to do to reverse that. And then, their diabetes go away and they're no longer taking medication. I kind of felt like that on some levels because I am taking this medication to balance it out, the hormonal, because it was too much estrogen. And I just felt like, okay. And that now to know the option, I have a choice in taking the progesterone was really good. But again, I chose to take it for one more year, but I will be monitoring myself over the year as well to make sure, you just got to pay attention to your body at all times. So one of the other things, the fourth question I asked her was, without having another ultrasound, how was my uterine lining being measured? I was just, me personally, I was just curious if it had decreased, right? Because in my previous videos, I showed how my uterine lining was originally diagnosed, seen at 11, I think it's millimeters, centimeters, I'm not sure, but it almost doubled within a couple of months, So, and I did not want to have another, again, ultrasound. So what she said was, based on the test results, again, she believes the uterine lining has regressed or maintained or not grown any further. Hallelujah. The test results did not reveal any type of hyperplasia, like the last biopsy. So that's the abnormality of the cells. She is not concerned. She wasn't so much concerned with the thickening as with the test results of the cells. That was her main concern, was what does the cell says, because she says that the results from the cells supersede the uterine lining. And she explained it to me this way, which is why I like this doctor, because when you break stuff down to me, I totally get it. She said that ultrasound is like a screening, like when you go have your mammogram, it's a screening that you're having. She said the biopsy actually tells what's going on within the cells and within the body. That makes so much more sense to me. So I was like, okay, cool. So the important thing is the cells and knowing that I don't have any abnormality whatsoever. So that's it. So my final question to her was, what are the next steps? Like, when is my next biopsy, my next appointment, and her recommendations? So of course, the next steps is that I will be staying on the progesterone an additional year. And due to the location of my fibroids, if I need another biopsy, it will be via the hysteroscopy procedure. And she did, because she didn't want to take the chance again, like I said, of me coming into the office, enduring all of that pain, and not really seeing where to direct the tool. And I really appreciate that as well, because I'm thinking, even if I was, numbed in that area, she wouldn't be able to see, where to direct the tool so she wouldn't damage anything else. So that was her thing. She said, and I would only need another biopsy if I saw any bleeding. So any bleeding that I see, then she would have me come in and do another biopsy via hysteroscopy. So my next appointment with her would be a year from now, which would be next June, to just do my annual, gynecological appointment. One of the things that she did mention was that my BMI, my body mass index, was 31, and a good number for me should be 30. And I should work on getting down, as obesity is a cause of uterine cancer. And I know I've spoke about that definitely in the month of June. I did talk about how obesity does affect cancer, uterine cancer, I should say. So that was that. And towards the end of the conversation, it was really nice. We wished each other very well, and we both wished we don't see each other until next June. It was all in jest, and of course, and kindness, because that means that I am still having abnormal cells, and nothing has changed. And so we're just hoping that we don't have to see each other, talk to each other until that time. So that was pretty good. So for me personally, after talking to her, the next step is to I guess in my mind is to getting back to where I was and developing a plan to get there. And you may think, well, what does that mean? So prior to the pandemic, and even during the pandemic, I was extremely active. I was a person that was at the gym at 5 a.m. before work, and I'd come home, change, and go to work, or I would get dressed at workout, get dressed at the gym, and then go to work. I was always at the gym Monday through Friday. You can find me at the gym. Saturdays, I'm riding my bike, doing some form of exercise along the lake. So I was always pretty active. And then, my eating habits, I don't think that I have bad eating habits, but I developed them. I did. And even during the pandemic, I did the 75 medium. So you can look up 75 hard, and then you can look up 75 medium. I did all of that. I bought a little cheapy bike and treadmill off Amazon, and I was working out still. I had the Peloton app, and I was doing it. But some reason I just stopped, and I don't know why, and I don't know how to get back there. And who knows if I'll ever get back to that person, because, postmenopausal, I'm different now. I don't have a desire to run anymore. So, I need to figure out what steps I need to take to help lower my body mass index. And you don't need a doctor to tell you. You see the plumpness around your stomach. Your shoulders, your underarms are waving. So your chin. You know all of that stuff. So I need to figure out what that is, and I don't know if that's yoga. And please, if you have any affinity towards yoga and don't like it, I've heard all the things. I'm good. I don't need any more unsolicited advice. So, but I enjoy yoga. Okay. And the peace it brings. And I thought about Pilates. I thought about dancing, because I love to dance. I could maybe dance some of these pounds off. In addition, going back to how I normally eat, like I haven't juiced all year, which is unheard of for me because I'm a juicer. And I haven't used a juicer all year. So there's just things I need to do and take baby steps to get there. And then lastly, what I need to do is I really need to mentally, I feel like I've been holding my breath since January 2025. And with this last test results of June 2026, I feel like I can finally let the air out. And I feel like I've just been holding on and just going through the motions of life. And now I feel like I can breathe because I didn't know what was going to happen. And yeah, so okay, so that's what I have to work on. So I have to work on me mentally and I have to work on me physically, but just the mental aspect of it, you know, it's a lot. When you're dealing, I'm sure if anyone's dealing with any kind of health challenges, it's a lot for you mentally and how you live your life going forward and how you lived your life during it. So that was pretty much it. I just wanted to give you an update, and no, I'm not going anywhere. I still have tons of content to upload regarding our uterine health. There is so much stuff out there. Who knew, right? So I just want to say thank you so much again for on being on this journey with me, watching all the videos in full, and your comments, your encouragement, whatever it may be, your engagement with this channel. I do say thank you. So let's continue to talk about uterine health. So until next time, I hope that you have a great and wonderful day. And I know that I am definitely, definitely grateful. So I hope that this news or this update was a blessing to you, and continue to follow me along on the journey and all the information I plan to share. Until next time, take care.